Hi and welcome to a lecture on acute coronary syndromes. Acute coronary syndrome is a term used to describe any pattern of clinical symptoms that reflects the development of acute myocardial infarction. This category includes the symptoms related to ST segment elevated myocardial infarction, non-ST segment elevated myocardial infarction, and unstable angina. ST segment elevated myocardial infarction is a condition that requires immediate reperfusion therapy, if possible through either thrombolysis or percutaneous coronary intervention. The introduction of thrombolysis or percutaneous coronary intervention for the management of ST segment elevated myocardial infarction has demonstrated ability to remove the offending thrombus from the affected coronary artery. The electrocardiogram is at the center of the decision pathway for the evaluation and management of patients with acute coronary syndrome, and is confirmed with serial cardiac markers in more than 90% of patients presenting with significant ST segment elevation. Now, let's get to discuss antiplatelet and anticoagulation therapy. In this session, we shall get to discuss aspirin, the thienopyridines clopidogrel and prasugrel, the cyclopentyl triazolopyrimidine ticagrelor. The cyclopentyl triazolopyrimidines also block the P2Y12 receptor. Ticagrelor has similar potency and speed of onset to prasugrel, but does not require metabolic activation. Altiplase is a recombinant form of tissue plasminogen activator. It has a short half-life and is therefore usually administered as an intravenous bolus followed by an infusion. Retiplase is a genetically engineered smaller derivative of recombinant tissue plasminogen activator. It has increased potency and is faster acting than the recombinant tissue plasminogen activator. It is usually administered as an intravenous bolus injection. Thrombolytic therapy administered early in the course of ST segment elevated myocardial infarction substantially reduces morbidity and mortality, particularly if the patient presents within 6 hours of symptom onset. The benefit is reduced for patients who present 6 to 12 hours after the onset of symptoms.